Very good evening to you, Doctor, and thank you for your time today. Well, when we're looking at the date now, we're way past when the mines actually opened on the 1st of May. The relaxation was put in force. Miners came in from around the country. A lot of them were screened. They were tested. Why is it that these 19 are only being tested now, or had they been actually screened and tested earlier on before resuming work?
I think what we need to clarify here is that it's only 13 that tested positive yesterday. But what has happened in terms of the mine when we do our investigation is that indeed on between the 17th and the 20th of April, 2,700 mine workers were recalled back on duty and they were screened, and those who were found to be meeting the guidelines for testing, they were tested and all of them tested negative. But then what happened currently is that we have 130 that only reported on the 6th of May. And these ones were subjected to mandatory testing because the reasons why they did not presented themselves with the first group, it's still not clear. And when we do our further investigation as a department, we've realized that out of those 13, they are not necessarily your locals. But also, that's the first thing which you are looking at, the community transmission mixed with interprovincial transmission or originating from interprovincial transmission. The second issue is that case number 6 from Kukunet district in the very same area. It's a contract worker in the very same mine. While he's not a permanent employee of the mine, he is a contract worker of a contractor that is a service provider in the mine. And they come from Eastern Cape. Upon arrival, they were also taken for testing, and he has tested positive. Other colleagues of his might have tested negative, but like we always say, the test results depend on the timing. It might have been all of them were positive at that time. It's only this one who tested positive, and we as a department did intervene because we found him residing in that settlement where they are all staying, and being told he was going to self-isolate, which was not even possible or practical. We then isolate him. Then this follow-up of the 130 being tested, they were in contact with the very same mine worker who, to us as a department, see him probably as the one of those who call super spreader. The reason being, the doctor who attended to him, also who is also working at the mine, also said positive. Staff member in her practice also said positive. Equally, some of the nurses working within the mine, that's what gives you to the total number of 17 employees within that mine testing positive. Results coming in not on one day. So that is probably what we could say could have brought into why some are being tested now while others were tested in time. They reported late as compared to while the others who reported earlier.
Dr. Phophi, we did get reports a bit earlier on that the mine has now closed temporarily just in order to get control of what's currently happening. But based on what you're describing now and what we know about the living conditions and the proximity issues in mines, what is going to happen to all of those 2,700 miners who had previously been tested? Did these 13 come into contact with those 2,700 who had previously been screened and tested and who had subsequently tested negative?
I think our role as a Department of Health is to advise, and we will continue to advise mine bosses. We'll continue to work with them, also through the Department of Mineral and Energy, to advise what is practical and when you look at the material conditions on the ground. We don't want to look at what is in pen and paper decided by someone who is not in the province, who would not necessarily experiencing what is going on. So this is where we have been insisting that the mines must be prepared to invest on the quarantine. If you want to operate, nothing stops you from operating as a mine. Learn from the Wuhan experience. When we went to evacuate our citizens in Wuhan, China, they came back having tested negative. But as a country, we quarantined them for 14 days, and we then release them when we are sure they do not have the virus. So we are saying, while we are still battling with the flattening of the curve, you can still operate, but have the place to quarantine your mine workers. If the 2,700 came in, screened, tested, you don't even need to test those who are not symptomatic. If you screen them and find them really not warranting to be tested because they are not symptomatic, and you have done their health profile to find that they are not vulnerable, they are not senior citizens in terms of age above 60, they are not having comorbidity. Put them in your own compound where they are going to stay there and continue to mine every day and coming back there, go and mine. You know that they are not interacting with us outside there. They will not be infected and infect each other. You will continue to be productive. But that's where we are finding difficulties in finding each other today. This forceful quarantine of 14 days before people even come and start working. We are more dependent on the screening and the testing. But the science is clear to say testing this virus depends on the timing. When are you going to get the true results? You might test me today and I give you that I'm negative, but tomorrow you'll find that I'm positive because it's dependent on this incubation period of this particular virus, and it differs from one individual to another. So while we are still studying this virus and trying to understand it, let's work with what we have. And what we have, the key here is let's quarantine everybody. And if we keep people from interacting with each other, we will be able to protect ourselves and continue with our day-to-day running of services. But as long as, because the mine workers, we went to check where they reside. They are residing in a very bad informal settlement where to infect each other, it will just happen like that. We are not saying the current setting got the virus inside the mine. They didn't. They probably got the virus where they are residing, where they are staying with contract workers who mine bosses do not want to take responsibility of those who are their contract workers. So that is another problem to say, if we are going to say this one belongs to so and so, and we don't deal with this thing as a collective, it will always remain a problem. But we believe that in our meeting tomorrow, when we will be meeting with again the mine bosses, we will be, because even the Premier was very clear to them to say, look, this has been our strategy as a province from day one. What has kept us to be where we are up to date was the issue of we invested on quarantining everyone who has been a close contact to a positive person. Even if your results come being negative, we still demanded that you quarantine for 14 days so that you don't spread the virus. It's only after 14 days that we will release you. And secondly, those who were positive, you will remember, we also used to say we will even forcefully isolate you because we've seen that people were not even complying with self-isolation. And it has worked until, unfortunately, now that we need to start having some sort of economic activities to run in the province. And this is, unfortunately, what we have to deal with now.
Now, MEC, you've just confirmed that a lot of these mine workers are actually from the community, which is exactly what the report here says, that 17 of them are from the community. What plans are being made for isolation of the mine workers who are found to be positive? Clearly and surely they cannot be expected to go back into the communities where they come from, where self-isolation is near impossible.
they are not all from the community, because our team has even interviewed. Not all of them are coming from within the community. That's why we are saying this could have originated from an interprovincial transmission, which has then got into. We have got the statistics that are in front of me show that. But nevertheless, whether you are coming from local or you are coming from outside the province or even outside the country, the mine and the department have the responsibility to make sure we isolate you. So that's why we're saying even the contract workers whom the mine did not isolate in the beginning when they tested positive, we did isolate as the Department of Health. Now, what we did is that when they reported to us yesterday, we have been working closely with the mine. I must indicate they are very cooperative. They are very working closely with us. We've already isolated all the 13 of them, and the team from the Department of Health has gone to the area where they are residing to try to get to the remaining 130 who are still waiting for the results. Because what should have happened is that once you take the specimen and treat me as a suspect, then you must quarantine me. And that's where we're meeting it. We don't want to quarantine. We only want to start to act when somebody tested positive. Forgetting that as long as I'm a close contact or I have been exposed to the virus, whether positive or not, I must be quarantined for that 14 days. So what we are doing is that we are quarantining all of them. We have isolated already those, and then we are working on the remaining 100 of the 130. We are also looking at the other community members that are close contacts, because those who are residing with them in those informal settlements, we are also looking.
We'll have to leave it at that. Time is unfortunately not on our side, but thank you so much for talking to us and bringing us up to speed as to exactly what is happening with the mine, which has closed down temporarily in order to make sure that it is able to contain the spread of the COVID-19.